We currently occupied another building up the road, about 13,000 square feet, and this is just under 19,000 square feet. 13,000 square feet in the old medical clinics used rooms like this to store medical records. And so now that we're electronic and we're 100% electronic, we can use this to actually provide clinic space and more access to patients. So these front rooms are all about that. We have our eligibility workers that if you come in as a new patient, you can sign up, meet with somebody right away. They'll put all your information into the computer. They'll sign you up for the exchange product. They can sign you up for Medi-Cal. We can even do food stamps or other programs here for patients that need access. One centralized reception area. A whole bunch of staff members. Hi, I didn't see you guys back there. Now I got to be truthful. They know what we're doing. We wanted to kind of to make sure that people knew that we were about health. And it's not just about catching somebody when they have diabetes, but doing all the work in advance to make sure that we prevent the diabetes. And so when you look down this hallway, we have clinical services and counseling services. Down at the end of the hallway is a room, which we can look at in a minute, that is all about the community. There's across the street is senior housing, and so we want to invite them down, and we can have computers in there. There can be games. There can be a place they can look up disease processes or ask questions or just kind of hang out and understand the process. So we wanted to make this really all about the community, and the design started with that fact. So if we walk down this way, so we walked by Marilyn's office and the two offices there in the hallway, but what their job is they look at our patient list, everything's electronic, and they make sure that people are actually coming in for their appointments and reminding them. If you haven't been here for a year and you have diabetes, you have other systems, or you just need an annual physical, she's constantly on the phone calling people, reminding them, hey, it's time to get in. And we find that's a very effective tool because a lot of people forget. Is it time? I get busy in my life, I'll go get a physical next year. And it's really important that we stay on top of that because it's all about the preventative work that we're trying to do here. Back in the corner there's 4 desks and it's a call center. And so all the incoming phone calls from the community that need to schedule an appointment, we wanted to make sure that the face-to-face encounters out there are between the patient and somebody in a live person. The old building we leased, it was built by 5 separate providers, and so there was 5 separate waiting areas. So this is the best thing we have here is one centralized office. Feel free to come on in.
Hi. Hi.
We'll invade you just for a minute.
Hi.
You're going to tell them about the window, right?
Yeah.
Yeah, okay.
So in the electronic world, everything's on electronics. Most of our EMR and our scanning, but occasionally there'll be a lab or an outside reference lab that sends us stuff on paper still. And so this job here is specifically assigned to just scanning that information to provide our chart. And then Donna here is our medical record specialist. So if patient transfers in or transfers out or we need additional information, Donna is on top of it. And then one centralized reception area. That's where we lock all the staff. So now we're going to head down to
Everybody's ready.
the left.
Yeah, you want to keep a little bit lower. All right, let's get this up.
So
how tall I was there.
Yeah, well, we could do that.
we have 3 main centers. One is here, we have a center in Downeyville, and then we've got another site at the core location, which is a drug treatment facility in town that we have a clinic inside. So within all those health centers, we have about 20,000 patients in the practice. And so we needed to design this building so that we can continue to grow that population. Because I was saying to you earlier, we're getting 600-700 new patients a month, which is good.
Yes, yeah.
So this is primary care, and these all look the same. Primary care, pediatrics. You can see everything in the room is electronic. Very happy about that. So the MA can enter all the data in the room. Not a lot of paper shuffling back and forth. Signal the provider knows when the patient's ready.
Pull up your medical records.
Pull up your medical
yeah.
record. Or,
And all the rooms are the same, so if you
Right.
switch rooms, you don't have to be searching for equipment. It's all kind of set up the same.
You just
So
log in and.
You just walk in and everything should be the same.
And the new electronic systems and the screens that they're movable is you can actually pull up a screenshot or a pattern that shows what's happening with your diabetes, how your health is going, and actually share that information interactively with the patient. So moving in that direction. So this wing is for about 5 providers. Again, thinking of HIPAA, stationed all the rooms so that you're facing out to the rooms so you can see what's happening in the direction. One centralized waiting area or area that people come in.
So we're looking at flow. So it's
Right.
easy for the patient to come in, know where they need to be, know where they need to go.
Right. And then, hey. And then on the back end, you'll see that these two wings are identical to one another. What we wanted to make sure is that if you put 10 providers in one area and you got that many patients, it kind of just gets chaotic. And so we broke them up into 5 and 5. On the back end here, we have patients that are staff members that do referrals, pre-authorizations, immunization room, dirty utility room to clean utensils, but this is the same as that, and that should make it more efficient for staff that have to go back and forth as well.
Right. And all the hallways are wide, so if there are people using a wheelchair, two wheelchairs can go by each other.
Yeah.
The other facility, you would have a crash,
Right.
or you could barely get two people to go by each other.
Right.
Okay, and the restrooms are the same. They're all accessible. Okay, we even have, I don't know where it is just yet, but we even have a wheelchair scale, which we didn't have before, where you can just roll in and we can figure what you weigh, and you don't have to get out of the chair.
Right.
So is this a model for the future?
Uh,
Might be replicated in other
Well,
parts of the state?
actually, it should be the way it is every place. Every place should be accessible.
Absolutely.
Yeah, I don't think this is really that futuristic, it's just the way it should be.
Yeah. No, it's well said. I'm not going to say any more about that. Back here is a good example of what Dr. If we come in this is a procedure room.
This is a little larger,
Right.
obviously.
So one of the things, and we'll let I think we lost some people. One of the things that differentiates us from places like Kaiser or other large practices that have been around for years is that because of the population and the Medi-Cal and the low-income population, there's not a lot of opportunity for specialists. At Kaiser, you've got tons of people. You've got your surgeon, you've got your
Endocrinologist, you
orthopedic,
name it.
endocrinologist all on site.
Pardon me?
We do a lot of this stuff in community health centers creatively. We have providers that subspecialize, that have areas of interest. And one of our primary care loves women's health, so we've got colposcopy and other machines that are working here. We use telemedicine services for ophthalmology or diabetes or other things that
HIV care.
HIV care that we can't get on site. And so where we don't have a physician, we can usually try to find a way electronically to try to make up for that shortfall. And
Is that telemedicine?
that's telemedicine, that's telehealth. So
Right.
we started with telepsychiatry, but that doesn't really work. If you're paranoid and think people are talking to you at the TV, you can imagine how that would work out. So we'll keep walking down this way.
And when we get to the specialty area, Scott will mention that we're bringing specialists in from the community that people would normally not be able to because they don't accept the plan.
He'll be here later.
Yeah. It's a contract. Our reimbursement rate, if they come and do work here, is higher than the Medi-Cal rate they would get there. That's great. So they can afford to see patients here. Yeah.
So
Yeah. Yeah, so we already have physical medicine rehabilitation. We're working on gastroenterology is coming in the next month or two, and then we'll bring some other services in. And we're even thinking of maybe putting in a small pharmacy. Because if convenience makes a difference.
Yes.
In other words, if I can send you,
One-stop shopping.
yeah, well, we don't like to use that, but it is that way. In other words, if we can set you up with somebody here, it's one place to go, and it's convenient for people. And if you can get your meds in the same spot, chances are you refill them more often and you're used to more consistently.
those are primary care and pediatrics. And so there's 5 providers in each of those bullpens. And so they'll be using these exam rooms here.
Big office you've got.
It's growing
It's compounding.
exponentially. It's compounding. So you already walked through this. This is all the I just want to show you it is identical. Makes more sense for flow. I'm not going to take you down to the basement area, but unless you want to see a basement. But there's
Area of refuge.
but there's stairs. Downstairs is IT. One of the things we learned and our board learned quickly is that we need to learn how to expand really fast. And, you know, with the Affordable Care Act, with managed care, with providers retiring in this area, we've seen a big boon, a large boon in patients coming to our health center. So we created a lot of design aspects into this building so we can quickly expand. And so downstairs there's 2,800 square feet of unused space. And the reason it made sense to do that is because we were built on a 10% grade. Nevada County does this everywhere. And so it's easier for us to build a basement area down there, and that could be for a future expansion on the other side of the building. There's up to about 30,000 square feet worth of expansion that we can get into at a future date. And so, and we put IT downstairs because that's where we wanted to be. IT guys like to be separated. So
But it's also cooler.
The pool?
It's cooler down there. And,
It is
and
cooler down
in
there,
terms
yeah.
of temp. So you don't have to cool the room as much.
Right. So down here this is more of a staff area, emergency services. So I'm taking you kind of the back. Go ahead and go this. Come on in.
Yeah, I'll just scoot in if you don't mind. Thank you. What this also does, since 60-some% of our folks are on Medi-Cal, a lot of them are obviously low income. And the other place we had was kind of worn and shabby. And we got the sense that we're just a provider for people of low income. And building a new facility makes it more amenable to everybody.
Part of what we decided we need to take responsibility for is with the exchange and with the managed Medi-Cal is there's not a lot of access to specialty care. And so we've directly started working with a specialist ourselves and found that those relationships are really coming to fruition fairly quickly for us. So we already have physiatry in site, we have a psychiatrist on site, physical medicine.
And physical medicine rehabilitation.
And then we are GI,
Yeah, it's a
the
different
local GI group is going to be rotating through and working here so they can provide access to the Medi-Cal population. We're in conversations with podiatry and orthopedics and some of the other specialists in
And
town.
OB?
OB.
Yes.
The other side, which is identical, is OBGYN. And so we have always done a maternal health center. We took over from the hospital here locally for about 3 or 4 years now, and now we're adding an OBGYN. So not only we're going to get involved in primary care, but we're going to actually start to do some deliveries here. And so starting January, February of next year, we'll have an OBGYN that's working on the other side as well. Yeah, we're very excited. A lot of pieces have kind of just fallen together, and it's been very exciting for us.
At the clinic, that's amazing.
Well, not at the clinic. No, we'll go to the hospital.
Oh, okay, you do, okay. I'm just,
Well, we hope. Well, I bet there will be 1 or 2 here if we run into that.
okay, so they'd just be seeing the
Yeah.
OBGYN.
Yeah, the OBGYN.
Right.
Okay.
So in the hallway is we talked about earlier. We're all about prevention, and so we've got 3 offices here, which are nurse case managers, RNs, and a maternal health manager. And so they manage if you have diabetes or a complex process, the physician will see you, refer you in-house, and they will do the education and follow up on your diabetes. We also have a dietitian that works on developing the health plan and the food program. So they're stationed here conveniently. Over here, we knew in the old building we needed to develop a dental program. We had access, and people in our surveys saying we needed more access to dental services. And so we literally in the old building took exam rooms and turned them into a MASH unit of dental. So this is my most exciting unit. This is now our dental suite, and you can look in there if you'd like. We have 4 bays, 1 operatory. We have a large, that's really the snazziest. We have a very large, pediatric dental practice, and we also do adult dental
they have
services.
Come in separate entrance, or is
Everybody comes through one
filtered?
entrance and filters in here, yeah. Hey, how are you? Good to see you.
And this is more of a procedure room. If something more complicated has to be done, we kind of just made a separate room for that.
We do conscious sedation now, which is kind of a liquid to put the kids asleep. A lot of times we get children that have 12, 15 cavities in their mouth. And so now we're able to use gas and have some other alternatives for the kids, and we can expand our services. In the back, there's a suite that's specifically blocked off so that we have kids that need more severe work. We can bring in a dental surgeon or somebody else, and we're in contact right now with a potential individual to do some dental surgery for us. So yeah, it's a cool program. Our dentists have gone into the schools, identified children, and then brought them in here, and it's a
now, are your dentists going to be staff, or are you bringing in
Our dentists are all staff. We have 5 dentists that work part-time, some from full-time to part-time, and we do cleanings and full dental services in the facility. So we may have a contract specialist if we have a dental surgeon that may come in once a month or twice a month and just see the more severe cases in here. So we'll go this way. Hey. And so, I think I lost Dr. TL. They drag him along. So this space is our expansion space as well. This is currently, we needed a space for administration, but what I learned early on is administration can always move really quickly. It's hard to build space for exam space because you need lots of water, lots of electricity. And so we built this space and we redesigned this at the last minute before we had most of the walls up and we moved it. We pushed these walls out and we made this into another waiting area. So this is currently administration, but each one of these rooms you're going to see here are plumbed and they also have electricity on the wall. So we can quickly expand into this wing and this will facilitate another 27,000 visits when we get to that point. And then administration gets moved. So come on through.
Very nicely appointed.
And that's nice. I'm so pleased. I'm so happy. Aren't they great?
Inspire tranquility you would have.
As you can see, this is just an administrative waiting room, but this can quickly be transitioned. We de-emphasize the administrative entrance because my job is to move us out of here as quickly as we possibly can and expand this into other wings. So each of the administrative space down there is, like I said, is already stationed. You can see that there's a room for another nursing station, so that was built large. On the bathroom, as we walk through, you'll notice there's a urine sample box, which you usually don't put in your administrative wings. You usually have that kind of trust in your staff and your employees. So, and then this over here we built as our boardroom. But this also quickly transitions into another bullpen for providers. So this is offices, so that's why you've got 2 doors. And so you got a place for the staff, all of those get turned into exam rooms and you quickly open up to another 27,000 visits. We have board members, because we represent multiple counties, our board members are in different counties and occasionally they get snowed in. And so we have communication devices so that if our Downeyville folks are in Downeyville and they can't get here, then we can talk to them and still hold our board meetings over video conferencing. So this is it.
Right. Beautiful.
Yeah, we're very
Impressive.
nice. About 19,000 square feet and very pleased, very happy. The location you can't beat. I mean, you're so close to grocery stores, pharmacies. Senior housing is all across the street. We've got in-home supported services offices across the street. And when you walked in the building and you saw the transportation, the bus is going to actually come in and drop people right off at our front door. Taxis and others. So there's no walking from the street or trying to navigate busy traffic. And so everything kind of just came together on this site. We got very fortunate. We have another 2 acres above us that we can use for additional parking. And like I said, there's another space on the side for a second building, if we are crazy enough to do this again. A second building, about 30,000 square feet, three-story building. So we've got lots of opportunity for growth and sustainability in this community. So very excited.
The overall theme is access. Actually for everyone in the community. It's not just for people that are on Medi-Cal or managed Medi-Cal. It's all plans, it's all comers, it's everybody. And part of that is having more space, more exam rooms, and more physical accessibility. I mean, all of that are ways that we can bring people in here and properly serve them. And as Scott was saying, as you look at the building, and areas can be converted, if needed, to additional space and additional service. And given the fact that we're expanding and getting, 65 new patients a week or even more than that a week, there are challenges every day as well as there are challenges ahead of us. And with the new space and with the ability to build and, and use additional space, we should be able to meet that challenge. It's going to be interesting.
Yeah, it already is. We appreciate y'all coming today.